that sets the tone, not just for this conference, but for the future of healthcare itself. Because vision alone is not enough. It is when vision transforms into action that real change begins. This session brings together thought leaders who have not only envisioned excellence, but have translated it into impactful moments across healthcare systems.
It is my privilege to introduce our esteemed moderators. Dr. Vijay Agarwal, President of the Consortium of Accredited Healthcare Organizations, a visionary leader who has been instrumental in shaping the quality movement across the nation, and Dr. Lallu Joseph, Secretary General of Consortium of Accredited Healthcare Organizations, a passionate advocate for patient safety and a driving force behind many transformational initiatives.
We have with us eminent leaders and exuberant personalities for today's panel discussion. May I take the honor to invite ever-respected Dr. Girdhar Gyani, Director General, AHPI and Patron CAHO, Dr. Venkatesh Thuppil, CEO and Director, Foundation for Quality India, FQI and Patron CAHO, Dr. Alexander Thomas, Founder and Patron of AHPI, ANBAI and CAHO, Marshal Dr. Pawan Kapoor, former DGMS IF Vice Chairman, RUS Education, Dr. Nagendra, Swamy, SC, Chief Executive, Ramaiah Hospital and Gokula Education Foundation, Dr. M.I. Sahadulla, Founder Chairman and Managing Director, KIMSHEALTH. Over to our esteemed moderators for the session.
Hello. So friends, it is my proud privilege to welcome you to this very special session of dialogue with our patrons. And I can say that this dialogue is not something like a routine chat, but here we have people, all of them, who are visionaries, who are individuals, who have built institutions that have lasted much beyond the lifetime of the other people. So here to extract from them as to what is our journey of making India a Vikasit Bharat by 2047. As we know that healthcare is a very unique role, I will say, in this country. You see, we need to kind of work towards restoring the trust of the community. And that is why I will say that the theme of this conference is very apt. So it is tech, touch and trust. It is to restore the trust of the community by also restoring our art of touching the community that we deal with and by accelerating the adoption of technology. How do these stalwarts look at our journey so that we are able to make a significant impact by at least 2047? Where are we and where we should be? So this is going to be the dialogue with them today. Hello, you like to?
Thank you. Very good evening, good morning. I think I still haven't come out of yesterday's evening cultural event. A grand welcome to all of you. As Dr. Agarwal said, this is a very important session as we talk about Viksit Bharat 2047. The new India in 2047 as we reach 100 years of independence. So that's all about vision to movement and dialogue. That's what we are going to be having today. CAHO, if you look at the journey, what started as a very small initiative, today has gone on to become a movement. So in the year 2013, when Dr. Girdhar Gyani and Dr. Alexander Thomas and all the founding members of CAHO probably put together the organization, what they had in mind was that it should become a sounding board to the accreditation bodies for their case on quality and patient safety. But today what has happened is that people have all come together. We call it the doorman to the chairman. Because healthcare cannot function in isolation, it is everybody together. And we are truly proud to announce that we have become a movement for quality and patient safety. How many of you agree with that? Certainly it's a movement. Thank you for making it a movement. And it's just not possible if we don't join hands. So that's exactly what we are going to be talking about. Nation building, joining hands, everybody together. How do we go about doing it? So let's listen to the 6 experts who are here, and I'll hand over to Dr. Agarwal.
So my first question is to, can only be to Dr. Girdhar Gyani, the Director General of AHPI, and of course our patron. Sir, AHPI gave the hospital sector a collective voice that they never had. Dr. Gyani, nation building requires institutions that can speak for a whole sector, not only for themselves. What made that possible? And what does it demand of leadership to do that?
Good morning, everyone. Now, actually, once I finished my term at Quality Council of India, there was actually no body in the country which was representing the collective voice of hospitals or healthcare providers. And this opportunity came to me because when some of the leaders like Dr. Prem Nair, Dr. Devi Shetty, Alexander Thomas, they were discussing about it, and they found out that this man who is completing or retiring from Quality Council of India, let us put him as a CEO of this upcoming association. Now let me tell you, I think my purpose was, because by my nature, I cannot build any trade union. I build this association with a collective voice which will work on logical grounds. In fact, the recent issue you have seen, that there was a tussle between the insurance companies and the providers. And I think we came together and have a dialogue with the insurers, and they were able to listen just because of the simple reason that they knew that we are together. So my whole purpose of forming this association is networking. Networking so that we can learn from each other. And because I can tell you, we sometimes look outside. There's nothing to look outside. Within itself, we have got so much strength, so much expertise. And now, after forming the 21 chapters, I think this association has really become a very strong body. And I think government listens to us, consumers have faith in us, and above all, all employees, they look at us for the guidance. And let me tell you here, when I am sitting here as a patron of the CAHO, that capacity building was one of the other objectives beside the advocacy. And I am very happy to tell you that capacity building part of AHPI has been so ably taken over and delivered by the CAHO. Thank you, CAHO leadership.
Thank you, sir. My next question is to only Dr. Alexander Thomas. Sir, you have founded not one, but 3 institutions, AHPI, ANBAI, and CAHO. Most leaders just build up one and protect it. You keep founding. What drives that instinct, and what does it teach us about institution building as a national act?
Thank you, Vijay. I'm very proud to be here and see how CAHO has grown. So let me start with the story. When we started ANBAI, it was forced on us. We had some issues with the National Board of Exams. We were not able to even talk to anybody. That's how ANBAI was found. In fact, we went to court against a national board. Different matter that the case was thrown out and we were fined 1 lakh. But today, ANBAI is a model organization between the stakeholder and the regulator, work very closely and have had huge policy successes. Now, how did it start? It's not that I get up in the morning and say we're going to start an organization. I think from each of these organizations there was a reason. So when CAHO started, this was the issue, we got together. And then one fine day when we were in CAHO, in an ANBAI meeting, a lot of hospitals were there. And it was a situation that the government owed us a lot of money, CGHS and ESIs. But when a CEO went to meet the authorities, he was met by the clerk of the undersecretary, made to wait for 2-3 hours. So we said, like in ANBAI, collective voice, that's how AHPI started. I think Dr. Gyani has given the details. And I must say that the starting of it is not, nothing is possible alone. So ANBAI was started, Devi Shetty was a big, huge force. Rajshekharan, I think Rajshekharan's boss is here, Rama, if you're here somewhere. Rajshekharan and Prem Nair, I think like-minded people got together. So after AHPI, I don't have to tell you about CAHO, it's grown exponentially. As Lallu said, our initial aim was, Dr. Gyani was leaving, we both said we need to have some sort of not a watchdog, but somebody to engage with NABH. But I think the present leadership has taken it many levels above that, and we are very proud of that. So recently, I think the organizations that we founded were all because of a need at that time. More recently, we have started something called Vaya Vikas, which deals with senior citizens. And just last week, we started something called the Sarcopenia Society of India, again dealing with a major issue in the country. What I want to say is that organizations cannot be done by one person. I'm a very religious person, and God leads me in everything I do, and I think without His presence, nothing will move. Second is the same type of, we're on the same page. And all these organizations have, I think, have had a huge impact. The original thoughts may have been different, but I'm very happy to say that these 3 organizations have touched at the national level, it's gone international, and back again, tell you that God's hand is there, like-minded people, and a need in the society. So I was just looking at how I got into it. So as a clinician, first you have problems, you discover problems in the clinical system, then you discover it's a health system problem, then you discover it's a social problem. And I think the way to handle it is all of us get together, because unity is strength, unity is networking, and unity can also lead and has led to policy interventions and implementation at the highest level. Thank you.
Thank you so much, Alexa, for that. And that brings us to a very important question. If you want to start an association or a society, the best person here is Dr. Alexander Thomas. So please take this opportunity and take his card. He'll be of great help to you. Any problem, he will start an association. Now, let me turn on to Air Marshal Dr. Pawan Kapoor. Sir, we all know that the armed forces are among India's most enduring institutions. Air Marshal Kapoor, what is the one principle of military institution building that healthcare has not yet embraced and must if we are serious about nation building?
Good morning, everyone. Thank you, Dr. Lallu, for this, and thank you, CAHO, for having us over for this first session of CAHO. And thank you, everybody from ISQA, for being here with us and inspiring us to greater heights. I'm very upset about this question, so please don't mind it. You're asking me one principle. Now, there are so many principles, so many doctrines that we follow in the armed forces, but I'll focus on one principle because she says one principle. And I have to put too many things in that one principle over the next 3 minutes. Let me give you the military ethos. The armed forces have one goal, that is to safeguard the territorial integrity of the country. This is met by the soldiers. As the soldiers go to fight in the front to maintain that territorial integrity. And the soldiers goes with the confidence that behind them is a medical echelon who will take care of them once they reach them. And that is what is the confidence on which they will go and fight for you and me. And that confidence comes from the fact because the armed forces medical services, they are at war during peace, so they are at peace during war. They are the shoulders behind the soldiers. And what makes them so? Because we follow an institutional readiness model rather than a service delivery model. And institutional readiness model means that we are proactive. We focus more on prevention than on taking action and reacting to a situation. And that is where I think the healthcare delivery system is now to take care of this model, that is an institutional readiness model. Readiness to help the population to prevent diseases. Readiness to focus on wellness. And readiness to take care of any unforeseen eventuality, be prepared for it rather than react to it. What we saw in COVID was a reaction, and it was knee-jerk reactions. Because we were not prepared for it, we never did a risk assessment because we thought pandemics will never ever come to us. But the armed forces medical services, they do not wait. They see all unforeseen circumstances that can happen. They do a proactive risk assessment and they become ready for that. And for that you require, number one, punctuality. Number two, discipline. Number two, sticking to your standard operating procedures. And number four, seeing the future before it becomes the present. So I think if you take an institutional readiness model, do your mock drills, do your exercises, simulate conditions that are likely to affect the healthcare delivery, focus on prevention, focus on the wellness and well-being of the population, I think healthcare will progress in a much faster, in a much better, in a much quality and patient safety oriented way. Thank you.
Thank you. And I think you took the lecture on risk management in just about 3 minutes. Thank you for that, Pawan sir. And we truly salute the men and women of the Armed Forces Medical Services. Thank you for that. Now to our lead man of India, Dr. Venkatesh Thuppil. Quality is the foundation of institutional trust. We all agree to that. Dr. Thuppil, across your work with FQI, where does quality most often collapse in healthcare institutions? And what separates those that sustain from those that do not?
Do you think it's $1 million question? To answer, first let me wish you happy morning and more than happy, healthy morning. We are all here to promote health. Organizations are formed, especially in our arena, looking at the sick persons. We want to make them better than what they are. They want them to become like you and me. Now, institutions or organizations are not formed by individuals, whether private sector, corporate sector, wherever, whether defense sector. Institutions are formed, whether CAHO or FQI or AHPI, by committed, passionate people coming together, like we have come together. You have formed an institution in which we are all sitting and comfortably exchanging our knowledge. When individuals come together with passion and commitment, such institution becomes stable. We are all stable today. Now the question is, are there times when we collapse? The quality collapses. What is quality? It is not just doing right thing at right time for the right purpose. It is not the affordability. Quality is not something, but it's beyond, I tell you. the trust and faith. On the foundation of trust, with the pillars of faith, we identify quality. When does it collapse in an organization? I'll tell you only once. When there is a disharmony between people managing the organization. It can happen because of some petty things, because of too much of expectation. Two things have to be noticed: over expectation and contribution will at times makes that institution go down. Remedy is there. For every problem there is a solution. We come across in our family, we come across in our society, in our working area. We need to understand the other colleague in our organization, and as a one soul, it is not individuals, as one soul, as one person, the entire organization should feel, commit, have passion, then it becomes sustainable. I tell you, all organizations, today we see what is the global scenario. Huge countries have collapsed. Why? Because of lack of trust and faith in themselves or with others. The only thing we need to sustain quality is to have unquestionable trust and faith, like what our Dr. Pawan mentioned in army. Unquestionable trust and faith will sustain quality, it will never collapse.
Thank you. Let's give a good round of applause, and I think he brought us to the theme there. It is all about trust, and that's what is lacking between us in the organizations, the patients we serve, the community, and the country and the globe. So trust is the answer. So I'll hand over to Dr. Vijay Agarwal for the...
So my question is to Dr. Sahadulla, the quiet, silent kind of a crusader that we come across as our patron. Dr. Sahadulla, KIMSHEALTH was built in one of India's most demanding healthcare environment science. And as you scaled, what was the hardest thing to protect? And what did you consciously refuse to compromise even under pressure?
Thank you, Dr. Vijay. It's a great pleasure to be here and, congratulate Pawan, with such a big growth over the years. Building up an institution, you come across so many challenges. And naturally, it's 25 years ago, 1997, 2000 is the time our hospital was established. There are so many challenges like quality, patient safety, governance issues, all of those will come. But I only will highlight the financial discipline. You will be compelled to build under pressure many times when there is a financial pressure. And we have taken back loans and hardcore loans at 18% at that time. And then anyone who would like to cut into the financial discipline. So I could be a bit candid if I say that, we started as a team, decided to, continue with the financial discipline at any cost. And when I say financial discipline, we never had any cash transactions, either to the vendor or to the doctors. So 26, 27 years ago, and we have not paid any doctor except through the bank. We have never given a referral fee for any patient referral or any other investigations. And many those days it was a common practice. That's why I wanted to be candid. And there are people who have asked me, how many CTs are you doing? And I said, we are doing 2 or 3. So you are losing out. Yes, I said, I am losing out. I can send you, a number of cities. I said, please do. No, but there is a reading fee which has to come to me. I said, I have radiologists to read, and I will not give any reading fee to anybody. And my radiologist paid by me. So, such discipline, and all the doctors were consultants, they were bank transaction, they have to pay the, TDS or the tax. And in the short term, probably we might have lost, but it's an ethical practice, it's a transparent practice. And in the long term, we really gained because there's no gratuity. Today we are one of the highest paying tax paying, organization in Kerala. And the doctors are very happy because they are never hunted by the tax department. No unethical practices. There is no kind of referral fee, no commission, no kickbacks. And that was very difficult to. I'm a doctor by myself. I'm an internist, came into entrepreneurship. And so we decided to go that transparent, ethical way. And we did it, and we are very happy. And I will always say that this is an example any of the young entrepreneurs going into should follow. Thank you.
Thank you very much, Sahadulla sir, and I truly believe that that's the way forward, the financial ethics, ethical management, and without that, we are not going to have the trust. I'm again coming back to trust. Now let's listen to Dr. Nagendra Swamy. We talk about the Gen Z all the time, and now we have the Gen Alpha also coming up. Dr. Nagendra Swamy heads one of the leading medical colleges in India, has been instrumental in training several clinicians. So, Swamy sir, are we producing the next generation of institution builders? Or are we producing clinicians who manage institutions without truly understanding how to build them, particularly in the context of Gen Z?
Thank you, Lallu. I think, good morning, CAHO. It's very heartening to see a couple of years back when we had the second CAHOCON, when we reached 1,000 plus registration, we were all thrilled. Today, I'm so glad we have reached 2,000 plus here. Welcome to all of you. And special welcome to the ISQA and their delegates who have become the partners with us in this. Coming to the question, I think both healthcare and education are very complex systems. They are governed by strict regulation. There is a boundary on which you work on it. Unfortunately, constitutionally, both are responsibility of the government. But when government doesn't meet those expectations, the private will move in and they will fill the gap, and that is what has happened in India. Today, the private plays a pivotal role in both education and also in the healthcare environment. Quite often we come across crossroads in this journey. Very often. Now the biggest thing that we are facing is whether both the sectors are business oriented or service oriented. According to me, this service component of both this section cannot be taken out. It's a business with service component. We need to always remember the service will encompass anything more than the required thing. Building up the new generation is a very key aspect. We need to holistically look at how the institutions are built. our educations are trained, our professionals are trained. Our mindset is we are managing, that is what is we are doing. We are not giving importance to innovation, cross-sectoral collaborations, interdisciplinary development. The time has come when we need to embrace technology rather than think as replacement. Global classrooms has to come, best practices of the different worlds have to come. Our IIMs and IITs have shown that we are lesser than anybody in the world. And I think we need to bring cross-sectoral, which yesterday we heard from Professor Sahai, how we need to get into an idea of moving away from silo and use the best in education and the best in healthcare. Unless we move into innovation, we move into learn, unlearn, relearn. I think the pace is so fast, the systems are changing, we need to adopt ourselves. Any educational and the healthcare, when it comes under same foundation, it becomes a huge opportunity to instigate and start that journey. I think we are on the cusp of journey when India is going to be ready for 2047 with a new generation who will have a very open mind and who embrace technology as a very complementary thing rather than think as a replacement of the thing. Many of our apprehensions about AI or anything are unfounded. We need to think these are the data is going to make a big change. How all these years the data will be collected, used for education and for the healthcare. I think the time has come to reorient ourselves to the newer aspects of teaching, newer aspects of professional learning. Both these sectors usually are averse to any risk-taking. I think we need to move away from that mentality and willing to take the risk and bring the newer innovations in it. Preventive and predictive will be the name of the game. I think we need to go in that direction. Thank you.
Thank you. And this brings me to a point where I must thank our patrons, not only for this morning, but for what you have spent your lives in building institutions that have been inspiring all of us and has been also the source of inspiration for CAHO to continue on its journey. And that journey, which has become remarkable, that an institution becomes a movement, it becomes a cause for everybody to come together to say that keeping our patients safe should become our obsession, not merely a lip talk, but we need to make an impact, that we need to reduce the incidence of medical errors in our institutions. And it is all because of the kind of commitment and the inspiration that all of you have shown us, that CAHO is on this journey, and we have had this CAHO family which has extended its borders, and now we have our people, our members right from all across the globe. So thank you very much, sir, and for inspiring CAHO, and I am sure that CAHO will play a very significant role in making Viksit Bharat in 2047, and will be a milestone for all of us. We will make you all proud, and I am sure that you will continue to guide us. Thank you so much.
Thank you so much. I should say that this was an amazing session with the great visionaries deliberating on vision. Thank you so much.